experts, of people who I have a lot of great respect for, to have a conversation of, with a tip of the hat to Tina Turner, what's government got to do with it? And the reality is, we've heard all morning about the role that policy can play, how our leaders can be part of the solution to building a more connected world and solving for the disconnected world. And I think the panel of people that we have joining us today are so critically important from various lenses that they bring to this conversation, so that we can all be working together, from Catherine to Troy to the GenWell Project to government officials, government-funded organizations, because we are all in this together and we need each other more than ever before. So I'd love to welcome up, actually I'm going to first off say a big thank you to MPP Patrice Barnes, who's here. She's an MPP from Ajax, and because of a connection that I met Patrice at the Collision Conference, Patrice was kind enough to put her efforts behind getting MPP Michael Tibollo here today. And Michael is the Associate Minister of Mental Health and Addictions. And so Michael, I'd love to have you come up and join us for the panel. Next up, it's great to have you here, Michael. Also love to invite up Dr. Sandra Allison, all the way from Victoria, who we've heard from a bit today, and you saw the question that she asked Julianne this morning, and how powerful was that? You could see Julianne even being a little overwhelmed by that question, which I think was a real tribute to the understanding that Dr. Allison has to this conversation. Dr. Sandra Allison is a family physician and a preventative health specialist, and has played a role as a medical health officer out in Victoria as well. So, Dr. Allison, love to have you come up. Next up, I'm going in order here. So Vickery Bowles is the city librarian at the Toronto Public Library. Vickery and I met about 6 years ago when I was invited to a conference because Dr. Quam McKenzie couldn't show up, and I was a last-minute fill-in. Maybe it wasn't that last minute, but anyway, our libraries have played such a critical role in our lives, and I think the evolution of libraries is a critical thing for us all to understand the role in that they play, that it's no longer about books. Yes, they're here. Yes, they're important, but it's so much more than just libraries. Vickery, I'd love to have you come and join the panel. And another person who I've had the great pleasure of sitting in her office and having a conversation, because she too was very open to the conversation about the work we do at the GenWell Project probably 5 or 6 years ago, Dr. Eilleen de Villa, who is the Medical Officer of Health for the City of Toronto. And I'd love to have you come and join the panel. So as you can see by their titles, this is a pretty significant group of people who have a lot of say and a lot of impact on the people in society, in the general population, because they look up to the people that are here and what they say and how they lead by example. And so I think, it's really, I think I have 1 or 2 questions, but it's more of a broad statement to everybody to say, hey, what's government got to do with it? This morning, Dr. Allison was here. The other 3 didn't get a chance to take Julianne Holt-Lundstadt's presentation. Dr. Kiffer Card, who I think has left us now, both from a Canadian lens and also from an American lens, understanding how important social connection is and the social fabric is to happy and healthy people, to happy and healthy streets, homes, societies. And so I guess I'm just going to open the floor with, and I know Dr. Allison is very comfortable in stepping into this conversation. Dr. Allison is on the board of the GenWell Project and has been as part of one of our scientific advisors for a few years. Is really, what role do you think government or government organizations can play in helping us build a more connected Canada? Whether it's, in what we do in a library, what we do in public health, or what we do as government officials. So maybe I can pass it to you, Sandra.
Excellent. Can everybody hear me on this microphone? Is it working? Good day to everybody. And I'm here visiting from Snuneymuxw territory, Coast Salish, in the community of Nanaimo on Vancouver Island. And I really appreciate that we've made space for this conversation, because we do recognize, I'm a physician, I'm a family physician, as well as a public health and preventive medicine specialist. But there are many things that we can do in our community. I'm very glad that you said fabric. And I wanted to acknowledge that on Catherine's work, she talked about weaving the threads of community. Back in about 2005, 2007, the Federation of Canadian Municipalities had a really great document that was called the Social Fabric and the Fraying of the Social Fabric, because at that time we were experiencing significant changes in supports that we had in community. So things that were traditionally there for people to be supported in community were no longer always present, and it became more of a question at a larger level federally, at the municipality level, but what is the role of municipalities? I know that in our communities in British Columbia, we're governed by the community charter, and I just wanted to reflect on what a community charter is. So in the Local Government Act, it reflects on the community charter. Municipal governments are responsible for the environmental, economic, and social well-being of the people that live there. So I find that that's really an interesting and important place to start, because if those are important pieces for municipal governments to be focusing on, then we need to understand who are the people that are responsible for delivering on those mandates in a community charter, and how do they get to those places of decision making. And I think that that's something that we can discuss about roles of government. We think about what should governments do, but I talked to Pete, maybe there's things that we shouldn't be doing. And I think that you can all name just a few things that you see happening in governments and with elected officials that really aren't contributing to the economic, environment, and social well-being in our community. So without giving too much away, I'm gonna leave it there for now, and hopefully maybe people can think of what are things that are happening that could be done, or things that we shouldn't be doing.
That's awesome, Dr. Allison. Eilleen, if I can come to you again from a public health lens, but coming from a smaller community to a really large community here in the city of Toronto, and you probably all saw Dr. de Villa many times through the COVID-19 pandemic. I think she was on my TV more than Superman and anything else that my son might have been watching. But it's a big challenge here in the city of Toronto. And I almost start this question with what can government do, but where are we starting from? Does anybody even understand the information that we're really speaking about today? Because I just don't think, it's not like exercise and eating well and sleep and all those other things. So how do you start when, the population may not even be conscious of what we're talking about?
Yeah, so Pete, first in your case, you start off with some better TV viewing, right? That I would start off with for you. And good afternoon, everybody. It's a real pleasure to be here. What's government got to do with it? What's public health got to do with it? Short answer, everything, right? At the end of the day, right, when I think about what is the role of public health, and I'm sure that whether it's from TV appearances or your understanding, particularly over the last 3 and a bit years, I'm sure we all have our conceptualization of what public health is and does, is meant to do, etc. And I'm sure there's some things you love and some things you don't love so much about what it is that you think about when you think of what public health is. But when I think about public health, fundamentally, there are 3 objectives of public health. And the first is to improve the health status of the population, to reduce inequities in health in the population that's being served, and to prepare for and respond effectively to outbreaks and emergencies. That's it. So let's leave aside the prepare for and respond to outbreaks and emergencies for just a moment. Clearly that's fundamental, it's important, and I hope we all have a greater appreciation of why that's so relevant. But the real fundamental role of public health on a day-to-day basis is improving the health status of the population served and reducing inequities. And the short version of the story, I'm going to give you the public health and preventive medicine residency in 30 seconds, right? What actually creates and maintains health is, yes, a little bit about your biology, yes, a little bit about your healthcare and access to it, but largely around the conditions in which we live, work, and play. So that gets to your point, Sandra. What is the community charter? Presumably, it's actually directed at improving or creating and maintaining the healthiest community possible. And that's all about what conditions we live, work, and play in. So what's government got to do with it? Effectively, as far as I'm concerned, the role of government and the role of public health in particular is to help foster that environment that actually allows people to be the healthiest people they can be. And clearly, human connection, social connection, the sense of belonging, feeling part of a community, those are fundamental components of that.
Well, you just gave me goosebumps as I was listening to you there, so I'm grateful for that explanation of what the role is. Vickery, now that we've gone through the public health, that's prevention, we're really upstream. You deal with the day-to-day. People are walking through the door here in all size, shapes, form, mindsets.
Right.
Tell me how the library is playing a role in helping people not only understand this, even through your staff, but the role that the library is playing in building a more connected Toronto in this case, but how libraries play that role across this country.
Well, this has been a long-standing role of public libraries, and we're often referred to as a community hub or an urban living room for people. And that's because we serve and reach people where they live. So in Toronto, we have 100 branches. So we serve people in 100 different neighborhoods and reach and serve them where they live. And I think that's a really important feature of public library service. And we have public libraries all across this country, and they're all doing this. It's not, obviously, just not here in this community. And I think what's important is people come to the library to work collaboratively. They come to work on their own, but they also come to the library just to be alone together. It's public space, and there's very little public space left for people to come to where you don't have to buy a cup of coffee or spend some money or have a special registration to get in. Anyone can walk into the doors of a public library, and they have access to the resources in that library and the staff as well. And so the role of the public library actually came into sharp focus during the pandemic because all of a sudden there were limitations on human connections. And so when the libraries closed, we turned many of our branches into food banks because that was a need in the community. And we saw many of the customers that we normally see in our branches coming to use the food banks in those branches. And we also hosted vaccination clinics. We had staff phoning seniors with wellness calls to make sure they were okay and just talk to them. And so many seniors were so grateful for those calls because of that human connection. And with curbside pickup, when we had to deliver our books to people that way, you have no idea how many people would say, you know, this is a lifeline for me, being able to come and pick up a book and talk to you, talking to our staff. So as I said, the pandemic put all of that into sharp focus. And the other part of the pandemic is that we saw more and more, as we opened more and more safety and security issues with disruptive behavior in the library, and then more people coming into the library with complex vulnerabilities. And so we have responded by taking a trauma-informed approach to responding to the situation, and we've hired a welcoming spaces manager and some library safety specialists who work in the branches with the most difficult situations. And then we've also hired workers from the Gerstein Crisis Center here in Toronto to work in a number of our branches and to work with people with complex vulnerabilities and getting them the help and the support they need. But the other thing that I just want to say is there has actually been some very recent research from the Canadian Urban Institute, for instance, that has looked at public libraries over the past 3 years and their role in their communities. And one of the things that they say in their report is that Public libraries are an essential part of the healthcare system because of the way we work with social workers, with community agencies, and with governments in supporting individuals and groups within communities. And then an even more recent report that's actually going to be released by Toronto Public Library later this month. We've hired a Danish research company to conduct an empirical research study on the social impact of Toronto Public Library on its residents, and it's a quantitative and qualitative analysis. And some of the results of that are really, really powerful. And I'll just share a little bit of that with you.
I just happen to have them with me.
I do, because I knew I couldn't remember them off the top of my head. Programming provides customers with transformational experiences, creating a sense of community with others with similar interests. Access to library spaces contributes significantly to people's emotional impact with a sense of well-being as welcoming community hubs, creating a calm and shared haven in a turbulent and noisy world. And staff also create a sense of well-being for customers, a human connection in a city of strangers. And I think that staff connection is really important because we have staff in all of these 100 branches, and they're there to serve and help people with whatever they walk into the library with and where they need help. So I think that human connection, it's something we heard a lot during the pandemic, but it's just something that has been taken for granted over a number of years, and as I said, really came into sharp focus during the pandemic.
It's so interesting as I listen to you speak there, Vickery. It's almost like the library is almost the equivalent of emergency services in the sense that you're picking up oftentimes the people who aren't being served through other aspects of society, I will say, let alone the healthcare system or whatever that might be. I do have a story from, when we first met Vickery 6 years ago. What I thought was really cool, the library out in Halifax had some confrontations at the door in the morning because some homeless people were waiting outside to get into the warmth of the library for a period of time. And so what they did was, rather than locking the door and kind of creating that confrontation, they bought a coffee machine and started making coffee and inviting the people in earlier than the doors opened. And I think that's the shift of mindset to say, hey, as the public library, as a community service, as a human connection vehicle, we can play far more than the books, the digital technology, and the connection that we need. And Eilleen, I think you had a comment there.
Well, I was just going to say, because we do tend to focus quite a bit on health care and emergency services, which I appreciate, and these are important.
Yep.
So certainly there's that aspect of that which the library provides for the community. But I would also point out that there's a preventive aspect there, right? By virtue of the fact that it's there, and you see young people, you have kids who grow up in a neighborhood recognizing that actually there is a caring place here. There is a sense of community. I do belong. So before you even run into challenges and need the emergency services, if you will, of the library, or those urgent care needs or support needs arise, you actually are creating a little bit, there is a prevention aspect there. And the reason why I mention that is that, of course, it's really, really difficult for us to describe the value of prevention, right? How do you describe the value of what didn't happen, right? It's just a very, very challenging case to make. And, I do want to take that opportunity to say that, yes, there's an emergency component, but there's also clearly a prevention component to this.
And let me be clear, my point wasn't that it's just about crisis management, is that GenWell is all about prevention. So yes, of course, that's what we hope everybody's using the library for that purpose, to stay connected. So absolutely, so thank you for that, Eilleen. Michael, I've left you to the end because you've been in a role as the Associate Minister of Mental Health and Addictions for, did you say 6 years at this point? 3 years. So for 3 years, you've been trying to, I'm going to say, not only address the crisis that we have, but also swim upstream and say, how do we make it better? And so as you look at, and again, we'll send you the videotape of Julianne Holt-Lundstad and of Kiffer Carr, because I thought the conversations this morning were just so powerful in recognizing the role that social connection plays in making people happier, healthier, live longer, society safer, more trusting, all those things. As you think of the role of government in building a stronger fabric and in improving people's mental health and reducing addictions, which we know are connected to a lack of social connection, I hate to just throw the line out, but what role does government have? What role does the Ontario government have in helping Ontarians feel more socially connected?
Thank you, and good afternoon, everyone. I think the provincial government, I think all governments have a role to play, but in particular the provincial government, because again, back in the day, I was actually the Minister of Tourism, Culture and Sport, and the libraries came under my jurisdiction. And one of the things that I worked really hard on was embedding mindfulness programs into the reading programs with parents and children, because it was a way to support them indirectly. But that led to other things being done, and I want to say thank you to Patrice and to the Minister of Education as well for looking at mental health literacy and embedding it into the school programs so that young people are getting the tools they need to become and be more resilient. There's an important place for government. The question is, what has been done in the past and what are we doing now and where are we going? The past, I would say little to nothing. And that's the reason why I came to government, because I actually worked for 10 years helping people with addictions and saw absolutely nothing being done to make a difference in people's lives. And addictions, as you said, there's typically a concurrent disorder. And if you look at the underlying issues behind the addiction, you realize that there are a lot of other things that should be done that aren't being done. Why is that? Government has always operated in silos. So when you look at the social determinants of health, you look at the work that I do, it actually crosses over 16 different ministries. And if those ministries are not working together collaboratively, we're not going to find the answers and the solutions, especially because most of the solutions are upstream. When we look at social connectedness, my background, I was a practicing lawyer. I'm in the process of completing my doctorate. I should be defending it in March or April of next year. And the focus of it is looking at the biopsychosocial model. The most important piece of all is the spiritual, which is very often missed. And it's not religion. It's about connectedness. It's about your neighbor. It's about like that project from Nova Scotia I really like. I have a home in Antigonish, by the way. I spent a lot of time in Nova Scotia. There's a lot that we can learn from each other, and there's a lot of resiliency building that can take place in situations if we allow those situations to evolve and grow. One of the things that I'm most adamant about in the work that I do is developing and encouraging peer-to-peer support networks. And again, why? It's that social connectedness again that's extremely important. And lived experience is the best experience to help an individual who's going through a challenge. It could be anything from postpartum depression, which I knew nothing about until I had the opportunity to meet some people that were peer-to-peer support workers in hospitals, to people with addictions. It's very different to have someone who's never been addicted talk about mental health and addictions. When a person who has lived experience speaks about it, the connectedness, that therapeutic alliance that we talk about in psychology is almost immediate because you share a common understanding. So what's the role of government? If you haven't had a chance to read it, the Roadmap to Wellness is a document that we created March of 2020, 8 days before COVID was declared an emergency. So we went from a very difficult, siloed, broken down, dysfunctional, and I'm not going to say system because it wasn't a system, of siloed approaches to mental health and addictions in the province of Ontario, to creating a document and then having a pandemic put on top of it, which made my work almost impossible. But we went forward, and thankfully, because of the innovation and maybe because of the pressure of having to deal with a very difficult situation, we're forced to look at innovations, everything from virtual supports to different types of, structured psychotherapy, all kinds of other innovative methods of treatment that were going to help individuals. And of course, the connectedness and the importance of connecting people through that. So I think the role of the provincial government is extremely important because it can provide a very strong leadership role. I mean, at the end of the day, public health is under health. Public health, personally, I think, and I brought this up at the First Ministers Conference in Health last week in PEI. I think the role of public health should be expanded to do much more. I think there's an incredible opportunity because they are frontline. They're in everyone's face. And that roadmap to wellness that I talked about, we've got to look at the developmental timeline of individuals. We have to provide supports and services that are geared to the individual at the time frame where they are, all the way from children and youth to our seniors. Every one of us, every single person in this room knows of someone that has had anxiety, depression. 500,000 people in this country don't go to work every week because of a mental health or addiction issue. It's 200,000 people in the province of Ontario. Stop and think about the productivity lost as a result of that, but also think about the repercussions to families, to individuals, and to the quality of life as a result of, not having those connections. So projects like the one we just heard about, I think are fabulous. I think they're incredible to keep people connected, to keep people talking. We don't have enough money as a province to take care of mental health through our psychiatrists, but so much work is done by our spiritual leaders. So much work is done by peer-to-peers. So much work is done in the trenches that doesn't really get acknowledged or even amplified, because I think that's really important. And prevention is key to changing this system. We may not see the results as a government, which most of the times, everything's geared to that 4-year election cycle. Thankfully, when I sat down with the Premier and first had this conversation with him, I said, Premier, I don't think I'm going to get you the results for the next election. And he said, that doesn't matter. Look after the people of the province of Ontario. We need to build a system. And that's what our job is building that system for the province, taking into account the libraries, the doctors, taking into account public health, working together collaboratively to make sure we build a system that's the system that people of this province and hopefully the country need as well.
Wow, Michael, very inspiring words, and I love the focus on swimming upstream. Eilleen, I think you just doubled your workload, I think, somewhere in there. But I think it's so critically important. It was funny, I was the Toronto Foundation, I'm speaking at their upcoming Vital Signs release. And one of the things they asked me is, what would you want Olivia Chow as the mayor of Toronto to do in order to support social connection? And I said, on our GenWell weekends, which are the weekends when we try to inspire Canadians to think about getting connected, I just said, I don't want you to host a party with 1,000 people at City Hall. I want you to get connected with your 3 people. And what I hear in you, Michael, is authenticity, which is, I'm here to help, and let's swim upstream, because if we can start building this, when you mentioned the healthcare system, we're obviously bursting at the seams. And the solution is not more beds, more doctors, more psychotherapists. It's how do we stop the lineups in the healthcare system?
So based on that, and just to give you an idea that if the right investments are made, the implications of that, UHN last year had 250 people show up to their emergency room 15,000 times. Okay? Now think about the implications of that to the emergency system at UHN. 50 of the individuals, thanks to work the City of Toronto with, I'm going to forget somebody now, UHN, and there was a charity, United Way. And the province, I think, was involved too. 50 units were built. I had the opportunity to go visit the 50 units. It blew me away. I could live there very comfortably. They were beautiful units, but the really interesting thing about it is that the 50 people that came out of that 250, as a result of having wraparound supports and services that were client-centered and holistic, they got the supports at home, at their residence. They didn't go to the hospital once. So what does that tell you about building the appropriate housing for individuals, giving them in that congregate setting the supports that they need? All of a sudden, the healthcare system starts to get some relief from the stresses and the pressures of having so many people coming into it. That is what we need to do. We need to look at holistic approaches to solving these problems, because they will fix all the other systems that we need to as a society to be able to function properly.
Love it. Sandra, what do we need to do differently?
Oh, I love this conversation, and I'm so glad that we're here.
I hope we.
And you know, I just was reflecting on Kiefer's presentation this morning about people's preferences for connection, and strangers were at the far end. And you mentioned city full of strangers, and I'd like to reflect on something that I'd heard once upon a time, and I'd like to see a show of hands in the room. When I say the statement, I want to hear if you think it's true or false. A stranger is a friend I have not yet met. True. Do you think everybody else believes that? Because I truthfully think that we've got a lot of fear and judgment in our communities and not enough generosity and compassion and caring. And I think what we're all speaking to is the need for communities to be caring and thinking about that. And so I need people that are leaders, that are models about caring and caring for the least vulnerable. You mentioned a number of people who are housed, but that magnitude is so great. This is not something that we can do as a system. Actually, the community needs to step up, and I'd love to see communities stepping into that gap. Anytime somebody says to me, oh, the health system needs more money to house more people, I think, heck no, give that money to community and let's make it happen there. Because I truthfully think that health happens in community. It's every one of you that's in this room. We can try and help as leaders, as government officials, and making good decisions. But if we have too much fear in our community, people just run to the health system and to government. We need trust in our communities. Goes back to my first point about trauma, trying to understand how trauma influences every little thing that we do, including decision makings in government, how we respond in our schools, how children are brought to school, or if they walk to school by themselves, children can walk to school in the right communities, in the right settings. So, thank you.
I'm grateful for you to bring up the conversation around strangers. We are launching a campaign at the end of November this year, encouraging Canadians to talk to strangers, which I know is such a far-fetched idea, but the research is actually quite compelling to say that talking to strangers may be one of the greatest things that we can do for our health, happiness, but also for inclusion and belonging of people who may not feel connected today. So it's not always about what's in it for us, but maybe it's about what we can do for other people as well. Eilleen, I'd love to come back to you and, you know, building on the conversation, what's in place now in the City of Toronto, but as you listen to the conversation and as social connection and human connection becomes more of a dialogue and more of the conversation, what could we do better? What could we change? How do we spread this message? And more importantly, and I again look back at Catherine, how can we get people to take the little actions that actually make a massive difference in how we connect as a society?
Well, you know, I think that was actually 4 questions, Pete, as it turns out. And I'll do my best to try to address them. You know, I think first and foremost, as you've heard, everything actually relates to public health. But as it turns out, you know, I think about Toronto Public Library as doing the work of public health. There are things that, you know, Toronto Public Health as the local public health department can do and does do on a daily basis. But when I really look at that which creates and gives rise to health, it's actually done, you know, as you say, by community and frankly by a whole slew of other important agents, whether it's a library, whether it's, you know, folks in a hospital, whether it's, you know, in your workplace, the people that you run into, right? This is actually what gives rise to health. And so public health is indeed everywhere. I do like the notion of actually encouraging people just to make a small little change, whether it's by writing a simple note or saying a simple hello. You know, as I was listening to you, Pete, I was struck by the fact, it sort of brought to mind a memory for me. My youngest son has special needs and is somebody who will talk to anybody. And one of the things that I found most powerful about him was particularly when he was younger. It was a little easier then, a little bit harder as you grow more from child into man, in his case. But we would get on the subway, and he loves the subway, and still does, and would just start talking to people. And what was interesting is that people would initially be a little bit put off, right? Wondering, why are you talking to me? Most of us who ride the subway, I don't know how many subway riders there are here, everyone's nose is in a phone, sometimes a book, more often a phone. And so people are kind of by themselves. They're alone. They're kind of technically together, but they're not alone together. They are really alone. And my son would just start talking to people. And quite literally, by the time I would be with him, he was relatively young at the time, and when we got off the train, just because of the conversation he started, literally everyone would say to him as we got off the train, "See you later, Ryan. Have a great day." And you could actually feel the level of stress, like it was tangible. It went from here to here. And the entire train's talking to each other, or at least the section of the train that we were in. His voice didn't carry all the way down the car. You'll be happy to hear that. But it was really, I mean, it was very, very powerful to me. So I keep trying to figure out, how do I bottle this thing up and bring it to scale? So I haven't quite figured it out yet, but it seems to me that really it is just little things like that that seem to make a difference. And I continue to be in awe of how significant that felt and how meaningful it was to myself and to, frankly, everyone else we were on the subway with.
I think it's such a beautiful example, and I'm just going to call out a couple people in the room. Tony, if you don't follow Tony, I don't know the handle. I Talk to People, is that what it, Talk to More People, Tony, is on Instagram. Tony goes around and talks to strangers all day long, posts those stories on Instagram. We need leaders. When you talk about bottling it up, it's bottled in this room. It's these people, and going out and talking to more people and saying, social connection is really important for you. You could do it too, but Tony's one. Richard is one, doing it in Calgary, who's out there building and talking to people about social connection. Every conversation we had, which enlightens Canadians that how important this is how we bottle this up and spread it around. It's Catherine doing work in Nova Scotia. It's every person in this room having these conversations. So that is how I think we get this message out. And next year when we do this for 5 days and we bring more people together, oh my God, that'll be crazy. Yes, sorry, Sandra.
Earlier about permission and giving people permission. And I say, I hereby give you permission to be vulnerable, to be connected to people, to be authentic, to be curious about other people. It's curiosity. And I'm very curious. Be curious, not furious. That's another great name, tagline. Anyways, thank you.
Ted Lasso said be curious as well. All right, I want to open up the floor, and I know we're getting close to time, and I hope you guys will give us a little leeway on the time that I told you we'd get you out of here with a gift. There's a gift, so at least you know. But does anybody, yeah, Michael.
I'll try to ask the question quickly, but I think it's for the whole panel, but specifically for Dr. Bell and maybe Mr. Tibollo. We talked a lot today about, the role of government and what's government got to do with it. I'm wondering everyone's perspective on what the private sector got to do. Is the private sector underdeveloped? Don't think they're overdeveloped? And what is your take from government, public health, government, and all your perspective on, hey, could the public sector do more? And how could they support your efforts and get us all connected?
No, go ahead.
Sure, thank you. That's a good question because, often when it comes to investments that the government's making, we invest just in new money, $525 million annually in mental health and addiction supports. And I always say when I go out and do an announcement, thank you to the corporations, thank you to the NGOs, the ones that are out there with that are being philanthropic and giving money to the organizations. Governments can't do it all. And we definitely need to have those collaborations between the private sector and thankfully, Bell, not to do a commercial for Bell, but the Bell Let's Talk, what that's done to allow us to grow the Beck Foundation, to allow us to grow the youth wellness hubs throughout the province of Ontario, the impact that that's having to provide a locus for youth to be able to go, be themselves, talk to each other, speak to adults that are caring and compassionate and providing supports for them. I can't tell you. it's tens of thousands of kids who have been impacted as a result of that philanthropy. And so I'm very much encouraging the continuation of that, because again, every dollar that doesn't come through philanthropy is another dollar we need to find in the municipality, the province, or federally. But collaborating together, we do make a difference.
Yeah, so I think if I was to add to that, no question, the philanthropic aspects, and the work that corporations do is certainly part and parcel of what they might do to advance this conversation. Then to think of it from an organizational point of view, I mean, at the end of the day, we all spend a significant chunk of our days in our workplaces. Some are a little more remote than others, admittedly, but we are spending a fair amount of our time in our various workplaces, wherever they may be. And my observation, both as somebody who runs a large organization and as somebody who observes other organizations, is that the more connected, the more a sense of belonging there is, and a sense of team there is in any organization, then clearly the more productive the business. So as far as I'm concerned, in the public sector, it certainly makes sense in terms of achieving our outcomes. I would imagine in the business sector, again, not being in the private sector, that's got to translate to bottom line. And I'm sure there's research that supports that.
Great question. I'd just like to reflect that community building and community development can happen anywhere. It can happen in your business. It can happen in the community that surrounds your business. The culture that comes from the businesses and from the business sector and commerce reflects on the community. And so we just mentioned the 3 terrible C's before: consumerism, comparison, and competition. Those really are drivers of some unhealthy behaviors in society. So as the business sector, we'd like to contradict those or overturn them. And so building community where people see themselves, a sense of belonging, a sense of purpose, and giving back, because I think that that's the other piece. You're nested within a community that's giving to you, so I always think that sense of social responsibility can go right from the top of the organization to the bottom. That sort of sense of culture has impact and ripples across the community, across families, and towards policy and who you elect. So I think that there's great opportunity there.
Vickery?
Yeah, I just want to add to that. It is a great question, and I'll speak a bit about the issue of philanthropy. We have gotten great support through our foundation and individual and corporate donations for things like we have 25 youth hubs in at-risk neighborhoods across the city, and this is a place for kids to come, youth to come after school, especially in at-risk neighborhoods. They often don't have anywhere else to go. Well, they do, but they're not good places. And so they come to the library, and what we found soon after we got these youth hubs going is that they're hungry. And they can't focus on their schoolwork or doing their homework or even behaving properly if they're hungry. And so we got great philanthropic support to provide healthy after-school snacks to these youth in at-risk neighborhoods and to all of our after-school clubs because so many of the kids that come are hungry. And the social services team with Gerstein Crisis Center that I was talking about, that's not from city funding, that's from private funding. And what that does is it gives us an opportunity to prove, like a demonstration project to the city, and it helps us get permanent funding for those kinds of programs. So it has been tremendously helpful to us getting that kind of philanthropic support.
I think we'll take one more. Yes. So if I can just repeat the question, it's really, I think it was more about what role can government play in helping support the local little person that wants to do good, building connections in their local community. Did I get it Got it right? Yeah? Anybody want to?
So maybe from a provincial standpoint, so there's money available for pilot projects through Trillium. There's pilot projects that could be done if they're presented through health, mental health and addictions. There's not a lot of money, but there certainly is. If there's data that supports the work that you're doing and you're able to present it using data, then it's one process. If it's a pilot project to gather data to see whether it's something that's going to make a significant difference or a difference, then that's something that can be looked at as well. We've funded, I personally in the Ministry of Mental Health and Addiction have funded many projects because again, this area does not have a lot of data. And you know, the only way you can actually create a system is if you measure, because then you can manage. But when you don't have the programs in place, you need to put them in place in order to see what data comes from them. So that's something that we can certainly look at, and the government is actively looking at different initiatives to see what can be done to augment the services that are being provided.
I think we'll wrap that for questions, but I also want to give any of the panelists, I think, Sandra, you might have some wrapping comments, not that you're going to wrap them, but that you have some comments to finish. Not a good rapper? All right, well.
In two different contexts.
Yeah.
So I just really wanted to reflect on the idea about consuming, what we consume, and the ideas around information and disinformation. The role of media, I think, is really important. And Catherine, I'm very pleased to hear that media was very supportive of her in her efforts, and there was a lot of positive media around that. But I think all of you recognize when you watch the evening news, it's about 1% of the positive stories are usually in the last 2.5 minutes of the news after you've stopped watching, and the first 78% is all negative. And I'd really like to know if there was a way as society, as government, as leaders, that we can start having different interactions with the news and we have a better understanding of what's truly happening. And in fact, that good news stories can make it out to the front page, because I don't actually think that that's happening enough. I think media is driven by controversy, and unfortunately that's what sells. And so yeah, just like reflecting on that. So thanks again, Pete.
Yeah, no problem at all. Well, let's put our hands together for this incredible panel. I want to say thank you to everybody that's on the panel. And the reason I think it's really important, I know the prevention conversation is a tough one. You know, you both, Michael and Eilleen, both mentioned it's not easy to do prevention because nobody wants to buy into it because there's no measurements. And even Julianne this morning talked about we haven't even measured interventions from a preventative standpoint because we've been so focused on the crisis and helping people when they're sick or, you know, or struggling. And the goal here of this conversation is to move upstream and to actually start solving these problems to keep people happier and healthier. And it's not an easy conversation for people who are being pulled in 75 different directions in what they do every day. So I'm very grateful to all four of you for being here, being part of this conversation. You know, we're trying to build a human connection movement here because we understand that building that fabric is so critically important to the health and well-being of Torontonians, of Ontarians, and of Canadians. And I'm glad that you were a part of the conversation because I think this is the first step to building this community and growing this so that we can actually take this, bottle it up, and start building a human connection movement across this country. So thank you so much for being here. And we have some gifts that Bobby's gonna hand out to our beautiful attendees, our speakers, and we're really grateful. Michael. I'm just going to say, and if you have time to stick around, we're going after some closing comments to go have a refreshment and some snacks. And I know you've probably got to get back to the house, but we'd love to have it. And Patrice Barnes, thank you so much for what you did to help support this conversation as well.